Bismillahirrahmanirrahim. Today is the 7th April 2022 and we are discussing the World Health Day, 7th April. The theme of the day is our planet and our health. In Isra University Hyderabad, Pakistan, we celebrated this day because of the Ramzan earlier on 25th March 2022, in which we invited the eminent speakers and we highlighted the day of World Health Day. Today is formal lecture or presentation on World Health Day. I hope the students of ISRA and other viewers of the Facebook as well as my YouTube channel, Dr. Sen Mushkolachi, and other social media platform. I think this uh, information will help in many ways to create awareness, which is the main purpose of the World Health Day uh, celebrated by WHO. Uh, this year, theme already I have told, and we have received the regional director message, Dr. Ahmad Mandhari, as well as the Karachi of sub office is cooperating and collaborating and sending the relevant messages and literature. Even on 25th March, they sent us the message of the regional director. We are thankful to Dr. Sarah Salman for her cooperation. Always she had been helpful. So today we are just going to discuss the main areas of the World Health Day. The first slide shows the logo and you can see that the whole world is looking disturbed and a little bit black, which shows that there is some danger related to the world health or planet health and even human being the part of this. So if you see, this shows that 2 billion people lack safe drinking water. On the one side, we have polluted or unhealthy air, and on the other hand, we have 2 billion people who lack safe drinking water, causing almost 8 lakh 29,000 people to die from diarrhea. This is one cause and main symptoms of the water pollution. Mostly the children are affected, and you can see the picture where the water as well as other health conditions are not satisfactory. Then we have one planet, we don't have another planet, so we need it and it needs us. So that is, I think, the central message. WHO, World Health Organization, estimates that more than 13 million, means 1 crore 30 lakh deaths are around the world each year due to avoidable environmental causes. This includes the climate crisis, which is the single biggest health threat facing humanity. Climate change or warming of the global atmosphere, basically greenhouse gases and shortage of water, shortage of food, floods, and heat waves. These things are very common nowadays in the world. And apart from this, we are facing the pandemic of the COVID also. So this is a situation where we are dealing with. Then comes that our political, social, and other actions. But one thing is that over 90% of people breathe unhealthy air resulting from burning fossil fuels or the fuels like petrol, coal, and other underground fuels which we are consuming or rather we are addicted to this. But latest uh, data shows that the above 90% are equal to 99% as latest briefing of the WHO and new report. So a heating world is seeing mosquito spread disease further and faster than ever before. Extreme waves, events, land degradation, and water scarcity are displacing people and affecting their health. Pollution and plastics are found at the bottom of our deepest oceans, the highest mountains, and made their way into our food chain. So that is a very serious situation, and global greenhouse gases emission is almost one third because of these fast food and other uh, food related activities. Air pollution kills 13 people every minute, and you can see the situation here. And then comes how many people die from air pollution. Already mentioned that every minute 13 people die from uh, the lung cancer, heart diseases, and stroke, which can be traced back to the air pollution. Then 9 out of 10 people breathe polluted air. Which of the below are examples of fossil fuels which can cause air pollution? The answer is all of them, and they include uh, the coal burning and petroleum and other natural gases. 3.6 billion people around the world don't have safe toilet. Then coming to the untreated human waste is making us safe and degradation of the ecosystem. This means that the toilet facilities, other drainage facilities, they are there. Take action and inspire others for healthier tomorrow. Then is the transport, bikes and other things, but the cars and other pollutants like rickshaws, they are the biggest threat to the air also in the cities. So we need a safe and renewed commitment to use cycles and use uh, walking and going to the offices, not through the cars and private, but through a good public transport system or by walking. And then is another energy use. We are making energy from the coal, which is highly polluted source. So we may use the wind, solar, as well as the hydroelectric energy. Nutrition is another area where pesticides and other chemicals are used to grow food, and intensive agriculture cropping is uh, tiring the earth, its capacity to generate crops or to grow crops. So, and even the food chain and other, they are using the chemicals and as a coloring agents as well as using high uh, sugar and oil contents. Healthy lifestyle needs quitting of the smoking. Smoking is responsible to cut the trees and to make the world non-green, because the making of the cigarette needs paper and other materials. So about 600 or half a billion trees are lost or cut to make the 6 trillion cigarettes, and about 8 million people either are dying or suffering from the smoke related or tobacco related. So consumption and shopping, buy less, plastic use, recyclable grocery bags. So you have to use disposable or other things just like made from the paper, or they are fresh and packed in a simple way as it was done in the previous era by the local people. They used to have fresh vegetables cut from their farms, or they were just purchased and put into the utensil directly from the cart or from the uh, transport system. So share what you are knowing about this. Then is the nitrogen dioxide from traffic, power plants, industry, and agriculture can aggravate respiratory diseases, particularly asthma. Well-planned public transport system within safe is another. So you can see that the wind energy and use of cycling is another area. This is the people dying from the diarrhea already discussed. So I think with this, we conclude that our health is completely dependent on our planet and we don't have another planet to survive. So it is the fight of better health of human beings and entire planet on which the animals, trees, as well as the social and other economic activities are going on. We appreciate the efforts of the WHO in Pakistan as during the pandemic of the COVID, and as well as the technical supply to get the vaccines and other facilities from the WHO systems, and NCOC as well as Isra University is running COVID vaccine center, and so far we have uh, vaccinated 85,000 doses of vaccines in last 1 year. I thank and congratulate the organizers of the Isra University on 25th March. We celebrated the WHO Day, and today the Vice Chancellor has also issued the message in which he has appreciated the Director General Dr. Aman Mandari and Dr. Sara Salman and Dr. Palitha in Mahipala in Pakistan for their valuable services and full attention towards the healthcare delivery system and its the good services to be provided under the universal health coverage. So Isra University is also providing the social and community services not only for the COVID vaccination, but recently tuberculosis and rabies centers have also been established. And in future, the Vice Chancellor, Professor Nazeer Ashraf Laghari, has in his message offered the cooperation to the WHO and to the government of Pakistan and government of Sindh. Already Isra University is present in Islamabad and Karachi, so it will be better that we work together for planet as well as our health and country. Thank you very much.